Take a break and join us. Gold Town, the Pahrump Nugget, and Lakeside Casinos.
On the May 21st Board of County Commissioners meeting, Henry Melton, the Nye County Public Health Officer, gave a presentation regarding Nye County's health ranking, the measles outbreak in the U.S. and other countries, and recommendations on how to better Nye County's health ranking. Prior to this year, the health ranking itself was 16 out of 17. Henry addresses that this is a bad ranking. However, he states that there are some variables that impact that rating that we may be able to influence. He speaks about a problem involving reporting health-related issues. This is the first variable.
An example, if someone has a drug-related problem, and that is discovered here in Nye County, and that person moves to another area, it is now discontinued. But if that person comes back, it is still discontinued. So we have to report that if the person comes back and that person is considered cured or well or in a different status. We don't have access to that. Myself and several other individuals are looking at how we can improve that.
The second variable that we can impact, he states, is getting more medical professionals to help out the population. He states that as the number of medical professionals goes up, our ranking will as well. Henry Melton states that he and a local doctor are currently looking into tying in programs with some of the medical schools. He also began speaking about addressing more prevalent diseases. He spoke about how he and a group he's been working with are trying to secure as much information as possible involving those cases. The conversation began moving towards the measles outbreak, and he discusses it via slideshow. The first slide shows the rising number of U.S. measles cases. The cases for 2019, as of April 26, has grown to 704, and while 2014 had 567 cases, that was for the whole year, while we still aren't done with 2019 and have already passed that number, which was the second highest number on the slide. These numbers were recorded by the Centers for Disease Control and Prevention. The second slide talks about a measles case that occurred in Southern California. Two universities, UCLA and Cal State LA, quarantined at least 129 students due to an impact of measles. Commissioner Koenig makes a comment regarding that slide.
When I grew up, I knew what measles, mumps, all that kind of stuff was, and we got vaccinated. And now it's, kids in their 20s that are just having a problem relating to that.
It's primarily because when you and I grew up, it was standard protocol for us to be vaccinated. Generations behind us were told that these things caused additional diseases, and they skipped that vaccination process. It's only recently that most of the municipalities have started to put in prohibitions against bringing kids to school who have not been vaccinated.
The third slide addresses what Henry Melton says may be misleading, is that Washington State says that their measles outbreak is over because they noticed the numbers going down. They have begun to let kids go to school without the vaccinations, despite parents' resistance towards it. He says that he would like people to be aware that some people will be coming from places where those vaccinations aren't required. The final slide addresses an incident in Germany where one person on a cruise ship who had the measles, accompanying more than 40,000 people on board, were not allowed to get off the boat by the minister of that country. He uses this as an example for us to be aware of the economic effect that measles can have. After Henry gives the recommendations summarizing what was presented earlier, Commissioner Strickland makes a request.
Can we ask you to do a presentation to the school board?
Yes, you can.
Thank you. Would you make that happen, please?
I will make that happen.
Thank you, Dr. Miller.
Thank you.
Okay.